last week, I asked our public health unit because we had just received, as everyone should know by now, we had just received the first shipment of the vaccines in our community. And I thought it would be really wise to have that in a more public forum about, okay, what's going on? You've received them. How are things going to be stored and administered, and put the needles in the arms? How is that all going to go? How's that all going to happen? And what is the framework being used? And Chris Beveridge from the public health unit has been, just want to personally say thank you for all your help, Chris. Very challenging times. And your leadership doesn't go unnoticed throughout the community, and myself and others. So thank you, Chris, so much for all you and your staff are doing. And Chris was very willing to say, yeah, happy to come in and do a presentation. And so thank you, Chris. I'll be quiet. I'll turn it over to you since you're the one in charge of this, and maybe we can see if there's any questions at the end. So go right ahead, Chris.
Sure thing. Thank you, Your Worship. I'm just going to bring up the presentation now, if I can. It's not showing, is it? Oh, hello?
Sorry, I forgot to unmute. Not yet, but sometimes it takes a minute, so we will awkwardly look at the screen and I will talk slowly to kill some time.
I wonder if it would be easier if the clerk could beam it up on the screen.
Okay, yes, our clerk actually has that option, and so the clerk is going to bring it up, and then you can just kind of guide him through if you have to go to another. I don't know what you have for us for the presentation, but if there's other slides or whatever, you can just verbally say to go to the next slide, and Stephen can move us along. So just give him a moment.
Mr. Beveridge, what I'll do is I'll bring the deck up. You can walk through it, and then when you want to switch over and show what I think is the public health dashboard, our folks will transfer back the presenter status to you.
I have screenshots from today, so it should be fine.
Okay.
Embedded in the presentation.
Perfect. Here you go. Over to you.
Great. Okay. So thank you for the invite today, Your Worship. If I could get the next slide, please. So just a little outline for this afternoon. I'd like to just bring Council up to speed on the provincial ethical framework for the COVID vaccine distribution, how COVID vaccine prioritization and the distribution framework is going to roll out, and then just finish off on the local instant rate changes before end of December until today. So if I get the next slide, please. So in front of you now is the ethical framework that's been put up by the province of Ontario that was created by the COVID vaccine task force in conjunction with the Ontario Human Rights Commission. And what this does is really, just as it says, outlining the ethical framework to deliver the vaccine. And these are the 5 pillars in which the vaccine distribution is based on. And this is the overall guiding document to allow the ethical and prioritization of who gets the vaccine, and then essentially who needs to wait until they're eligible to receive it. So first off, we're in the first column, we're minimizing harms and maximizing benefits. So what that means is getting the vaccine to those who need it the most. And that will reduce our overall illness and death of COVID within the community and within the province. So it's protecting those at greatest risk of serious illness and death based on what they do for employment, i.e. long-term care, direct client care workers, and also residents of long-term care. So they are at the top of our risk category, and also the very group that we're trying to minimize harm while maximizing their benefits so they can continue providing that essential service within long-term care, retirement home, and other sort of congregate settings. Our second pillar is equity, And that's really respecting the moral and equal status of human rights for all individuals, as we can distribute this vaccine without any stigma or bias. So we're really sticking to the prioritization of groups, and factors such as status in the community or like social status, prestige, et cetera, don't come into play, because we're really focusing on our high risk population and that prioritization of our most at risk people, both in long-term care and retirement homes from a staffing and a resident point of view. Our third pillar is fairness. So throughout the vaccine distribution framework, fairness ensures that everybody within a prioritized group will get the vaccine, and eventually anybody who wants the vaccine will get it. It just takes time in which to deliver the prioritized individuals to more, people like me than the general population who will have to wait. And we're also providing it with a decision-making framework or an informed decision. So we're providing information through our website so people can make an informed decision about the vaccine. The next pillar is transparency. And new today on our dashboard on our website at the health unit is a report on number of doses administered, and that will be updated on a daily basis. So transparency is also to ensure that the underlying principles, such as this ethical framework, are shared broadly. And this slide, you can see on the link below, is on the provincial website. And the framework is then shared with really publicly, so people understand what the ethical framework is for vaccine distribution, and know that the prioritized groups are being looked after in terms of getting their vaccine. And finally, legitimacy is really our science-based or our scientific evidence that are informing our directions. Evidence-based decision-making is identifying priority populations. And it's that legitimacy which is going to go right back to the first pillar to minimize our harms and maximize our benefits in terms of reducing serious illness or mortality from COVID. And then finally, the foundation of all these pillars is public trust. And so events like today at Council, sharing information, our dashboard, sharing information on number of vaccines distributed, et cetera, is all a part of the public trust to ensure that decision-making processes are shared, and then the public has confidence within the system, within the provincial immunization program. And like I say, this is available on the provincial website. So moving on to our three-phased approach for vaccine distribution, and this is for both products, Pfizer and Moderna. Right now, we're in phase 1, and this is subject to change based on vaccine availability. As we can see in phase 1, our high-risk population vaccine campaign is underway. It started last week. We used last week as first off, to get a small number of vaccines to start administering to high-risk populations. So we had under 1,000 vaccines delivered to us last week. And we used last week to become accustomed to the vaccine, being a very new product. It's brand new. It's only been in the province really for 3 weeks. And we've had it since Tuesday, correct me, I'll correct myself. We started our first vaccine on Wednesday, and we've been used last week to learn about the product, how to maximize its efficiency in terms of getting needles into arms, so to speak, and really doing a real live run through of how our clinics roll and flow, and getting all our metrics to learn from last week to be able to implement it for this week. So we ran clinics last week, Wednesday, Thursday, Friday, used our lessons learned over the weekend to rejig how we do things to make it more efficient and effective. We're continuing with our vaccines we received last week, today and tomorrow. But really by end of tomorrow, if we don't get another shipment, we no longer have vaccine in stock. So it's really a just-in-time delivery for the Pfizer product. And we don't know when we get our next shipment until the same week it arrives. So for sake of argument, we should know today or tomorrow if it's arriving Wednesday, Thursday, or Friday of this week. So it really is a just-in-time delivery. So with that in mind, as we have learned more about how to use the vaccine and how to be efficient with it, we are having weekend clinics, both in our Guelph location and also within our long-term care settings over the weekend, providing the Moderna vaccine with some community partners. So thank you to Wellington Guelph EMS for assisting with that vaccination campaign. And so weekends clinics start this week, both here in Guelph at the Public Health Office and also at long-term care homes. As you can see into phase 2, so really our aim is to have our high-risk population vaccinated by February, of course, vaccine dependent for delivery, and moving into phase 2 as early as March, but as late as April. And that's where we start having our more broader part of the community vaccinated, so essential workers, and these are all defined by the Ministry of Health and then provided to the health unit to focus on. And then phase 3, we have the steady state of, we don't know the product yet that may be used for phase 3 because the products are still in the approvals process. But that would be early summer into the summer, where we're now having remaining eligible Ontarians getting the vaccine. I think I'll just go to the next slide. And the key point of that last slide was just to indicate that it's a 3-phased approach, focusing with the most vulnerable, moving into the general population over phase 2 and 3. This is just a quick snapshot of the record of immunization. So throughout Ontario, everybody who gets vaccinated for COVID-19 will get a similar looking receipt or record of vaccination. And it's just basic information: name, health card, date of birth, the date the vaccine was administered, the type of vaccine. Right now we only have Pfizer, so that's the one that's indicated. Where it was provided and by whom, and when your second dose is scheduled for. Keeping in mind both Pfizer and Moderna require a 2-dose separated over a period of time, 21 days to 21 days, depending on the product. So this also serves as a reminder to come back and get that second dose. When someone gets their second dose, they would get a similar receipt saying they're vaccinated. So there is a record. It's a Ministry of Health approved record, and this is what people will have once they're vaccinated. So next slide, please. So going into our incident rate, this is our incident rate from last Friday, just on the 8th of January. Interestingly, and of concern, is by the end of December, so a week earlier, we had 95 cases per 100,000. Moving into January, after our first week in January, we had 138.5 cases per 100,000. Today, our next slide, is 149.2 cases per 100,000. So we can see that increase in cases over time, which leads to the transmission within the community. So despite our best efforts to contain the virus, and despite our best efforts as a community to do what we need to do to prevent people from getting sick, we are still seeing people getting sick within the community, and the rate keeps going up. We had the lockdown announced that was to happen for Boxing Day. We've had a complete infectious cycle, so a 2-week block, and we still saw rates go up. Most of our cases we can link epidemiologically, so we know where they're getting it from. It's the non-epi linked one, so that green line in the bottom left corner at 19.5 are the ones that it's just sort of random community transmission. We can't really determine where they're from. But the concern here is the increasing rate that we're seeing, and really we're seeing that across the province. We've had some record daily highs into the 3,000 cases per day. That is connected to this type of increase at 149.2 cases per 100,000. So it is very much connected. with the provincial increase in cases. So I think that's my last slide. Yep. So maybe I'll turn it over, Your Worship, for questions.
Thank you very much. And I think I do see some hands here for sure. I see all of you, no problem. I just want to quickly ask, have you thrown any, have any of the dosages of the vaccine gone to waste? Like you got under 1,000 last week. Have any of them gone to waste yet? Or are they all getting into arms?
No, they're all getting into arms.
Okay. Okay, that's good. And as of right now, you said either by end of today or tomorrow, you'll be out of the complete first batch that you received and started last Wednesday.
And unless our
Or
new
Tuesday.
shipment arrives,
Sorry.
unless the new shipment arrives before then, that's correct, Your Worship.
Okay. And you've confirmed that weekend vaccinations and such are already in your work plan, that's going to happen.
That's correct, yes.
Okay. Okay. Great. Thank you very much again. Councillor Karan, I saw your hand go first, and maybe we can try to make these questions quick and we can get through it so we can get into our agenda, okay? I see all the other hands.
Thanks, Mr. Mayor. It was a similar question that I'd heard over in, I think it was Waterloo region, that people weren't showing up for their appointments, and they did a kind of an open call and wasted vaccine. Come and get your vaccine if people aren't showing up. So you've kind of answered that none of the vaccines. I know they have a window of opportunity, and that we're not wasting any vaccines. So thank you for that. The second question was, there's a lot going out on social media of a political nature that it's going to take 5.5 years at the current rate of vaccinations to hit the 70% mark that will allow us herd immunity, or that will provide for herd immunity. Is that an accurate or is that a social media myth?
I would say it's accurate based on what, say, just for example, we administered last week 470 some odd vaccines last week. So that was our testing, our learning, how to use it. So if we maintain that rate of vaccination, yes, it's going to take 5 years. But the more we get vaccine, the more clinics we can have. The more different vaccines we get even increases that capacity. So right now, this particular health unit, Wellington, Dufferin, and Guelph, is limited right now as of today only to the Pfizer product. Lots of limitations to the Pfizer product, minus 70 freezing temperatures. You're not allowed to transport it very far, so a lot of limitations. When we get the Moderna product, ideally this week, then that we can then deploy to long-term care units and vaccinate more people. And then that can be put into other clinics and other settings. As different products that are more, let's call it stable at refrigerated temperatures, like we would see with a flu vaccine, then we can start seeing more clinics and more broader public clinics, which then increases that uptake. So right now, yeah, it probably would take 5 years based on 400 doses a day. When you look at from a flu clinic point of view, this particular health unit can easily, on its own, just its own staff, 1,000 people a day, but under different conditions. So when we do a seasonal flu clinic, we generally have, it's a first come first serve, or even if it's appointment based, we still have people waiting. We can't have any waiting right now because of COVID restrictions. So we're limited in the occupancy in our building. We're limited in the physical distancing requirements because we don't want people getting sick while we're at our clinic. And so those are all different limitations that come into play. The more we can diversify the product within the community, the vaccination product with Pfizer, Moderna, et cetera, we'll see an increased rate of vaccinations happening and with more partners. So right now it's public health unit staff with EMS staff that are going to be deployed and vaccinate long-term care. Over time, we'll see other components come on board in relation to that phased-in approach with the framework from earlier, where we potentially can have pharmacists delivering it, or family health teams, or whatever the case may be. So we will see a change. We're still in very early days, of our vaccination campaign. It hasn't even really been it hasn't been a week yet for us. It's only been 3 weeks for the province, and that's using hospitals and other providers as well. And I think it's important to note that as of today, WDG Public Health is the only health unit that I'm aware of that is actually providing vaccine to its area. We're the only one in the province. The rest is being done through hospital partners, et cetera. So I think this is an important point, that if we weren't doing it locally, we wouldn't have the vaccine. It locally, we wouldn't have the vaccine yet, because there are some other jurisdictions in the province that don't have a single dose administered because they're not set up yet. So
Thanks.
yeah, initially it does take time, but once we get the bugs worked out, it'll be full steam ahead and we'll get it done.
Okay, and my final question, and I don't need a why as much as an approximate time. I know that, and I absolutely agree that vulnerable citizens key priority for our community as well. But as a city council, can you tell us where in the pecking order are our first responders? I know that there had been some question about whether paramedics were first responders, and of course our police and our fire are going out into the long-term care facilities. So can you give us an idea of what the pecking order for our first responders, city employees, are in the vaccine?
Right. So it all goes back to that ethical framework and minimizing harms to those most vulnerable from getting serious disease and potentially death. So in terms of a first responder level of vaccination, our EMS colleagues are considered healthcare workers. And so they're put into that priorities setting framework as a healthcare worker providing direct patient care. And that's the key thing, direct patient care and direct sick patient care, I might add. And they're also going into homes to help with the vaccination campaign. Other first responders aren't necessarily considered healthcare workers, and they're a little separated from that environment. And in talking with some of my police colleagues, depending on the jurisdiction and who they are, not necessarily Guelph-centric, but they're not considering themselves as a priority service to vaccinate because they're not providing direct patient care. There are some firefighters that do based on a medical call, and that's then it morphs into more of that essential worker category, but not the higher risk priority category that we would see with our personal service workers or nurses in intensive care units or those high risk occupations for exposure.
Okay, thanks.
Thank you so much. Councillor Gordon, next, please. No? Okay, that's awesome. Councillor Salisbury?
Thank you, Mr. Mayor. Quick question with regards to the 2-dose requirement and the prioritization. Somebody who is prioritized to receive their first dose, my understanding is that we're not explicitly holding the second dose, that we're releasing it as part of the first for future or further priorities. Somebody who has been vaccinated and needs to get their second shot, they're considered to be where on the priority list? Would they be considered still the priority that they were at the beginning, or would they be demoted effectively?
No, that's a part of that. They'll be booked an appointment to come back as a priority recipient of the vaccine.
Okay, because how does that square with what I'm hearing about the second dose not explicitly being reserved, but in fact being released? Can you explain that?
So initially the direction was that I'll say had the health unit hold that second dose. So say we had 500 doses shipped to us, we would vaccinate 250 people, and then the second dose would be held, and then we would vaccinate those 250 people again with that same shipment. So that was the initial plan and direction from the province. That has since changed, and we've been directed to whatever you have, vaccinate the first time, and then you'll get doses to do the second the second rounds to do the booster. So that's built into the logistics and the supply chain. So when it's time for people's second dose, we'll be shipped that amount to do the second dose, as well as people's first dose potentially.
Okay, thank you.
Thank you, Councillor O'Rourke, then Councillor Hoffland.
Thank you, Mr. Mayor. Through you to Mr. Beveridge. First of all, thank you so much for all the work that's taking place at Public Health and throughout the healthcare system locally. We cannot thank you enough. I just had two questions. A quick one is you said you're not sure if there'll be additional vaccine tomorrow, but is there a shipment that's planned? Because I know that there are people who are scheduled to receive vaccinations in the coming weeks. I'm just wondering, is there one that's planned, and sort of unless something awful happens, there will be a delivery?
Yeah, our planning relies on that shipment to arrive this week. We're planning to have it arrive Wednesday, and early reports it's in transit. I just don't have a delivery date and time when it actually gets to my door.
That's totally fair. I just wanted to know we weren't kind of waiting. My other question is similar to Councillor Caron's question around some of the logistics. So we are hearing a lot of people saying, you know, and I asked, you know, could this be going faster? But I think people don't understand necessarily all of the logistics, the training, the tracking, the computers, you know, that are required for this. And I'm wondering if you would just like to provide a little bit of some of the complexity of the logistics to give people a sense that, you know, these things will get faster, but all of this had to happen first.
Right. So I think what most people see is someone getting a needle in the arm, and that's all it takes. And so I appreciate the question. I think it's a really important one to discuss. The global supply chain of the Pfizer products, that's the one we're getting, is massive. It all comes from Belgium. It has to be shipped internationally. Our last dose, or our last shipment came from Belgium to Germany into Canada. The shipment we're expecting this week is leaving Belgium. It's in New Jersey right now, and has to then come into Canada. It has to clear customs at all those different points. So that's just shipping it out, not making it or packaging it and all the other bits that go in manufacturing. That's just from the point they ship it. The other piece to the supply chain is first off getting it, but then our own internal workings, and this is the easy part really, because then we have it, we put it in our freezers, and we start using it that day. We start thawing it out in the moment. But all the work up to get to that point, we are limited in that we have to use the provincial issued tracking system to get that provincial ticket, that vaccination of receipt. So there's that whole IT and computer software component that we're managing. We're managing our transparency of vaccine doses administered through our website and our health analytics, as well as still managing all our case management and contact follow-up work is still going on. As you saw, our rates were going up, and I still have staff dedicated to case management and all the health analytics that goes into the reporting of those cases and following up and self-isolations, et cetera. But the logistics piece is, it's a global phenomena that, you know, we're not the only one getting this product. It's being sent all over the world. So it's trying to coordinate between the health unit, the Ministry of Health, and let's use Pfizer as the example because that's the product we're using, and coordinating that just-in-time delivery, not just for us, but for the next health unit over, or the next hospital, or the next provider. So it's always in motion from the manufacturer's point of view. So it's a very complex machine that's making it work. We're just on a narrow receiving end, and that's why that just-in-time delivery piece can seem, I'll call it a little disheartening, because it's just sort of spur the moment, but we have plans in place in which to manage that just-in-time delivery. So it's a very complex machine that's making it all work, and we're just a very small point to get it distributed, and that's where then we take over and make it happen and make it work. Hopefully that answers your question.
Great, thank you, Councillor Hoffman, and then Alt and Gawler is who I have left.
Thank you, Mayor Guthrie. All of my questions, fortunately, were answered, but I would like to take this opportunity to also express my thanks to Public Health for their leadership.
Thanks, Councillor Hoffman. Why don't we do what we did for the other people earlier today, right now? We'll do one of these for all of our public health people. Thumbs up and clapping for you guys. That's a, hope you don't mind me launching off that, Councillor Hoffman, what you just said there. That's a perfect time to do it. Councillor Alt, please, and then Councillor Gawler.
Here. Mr. Beveridge, thanks very much for the report. It's truly appreciated. There's a number of specific questions that I've got. You mentioned a target of, I believe, 10,000, I think, per week. And just a quick one, is that Guelph or Wellington, Dufferin, Guelph? I'm just curious because of the population differences.
Sorry, I don't know if I said 10,000.
Right at the start of the presentation, you'd made
Oh,
reference
in the slide.
Yeah.
That's our ideal target. By the end of the month, we'll have that. Again, vaccine dependent.
Okay.
And that's with using our partners.
Yeah. Okay. Now, the other question that I have, it's a fairly important one, and I don't know that you do have the answer, and that is the number of refusals. And in particular, I'm thinking in terms of chronic care and chronic care support workers. I have heard that a number of people are intending or have refused these. Is there any sort of a protocol in chronic care homes for residents to long-term care? Refuse these, because if we want herd immunity, we have to get to a particular percentage. And I'm just wondering, has that been considered yet?
That's certainly, I'll call it a risk in that herd immunity concept, but no one is being forced to get the vaccine. It's done through that informed choice. So we certainly encourage people to get vaccinated, because that's what's going to see us through to the end of COVID. But I don't have any other indications on numbers of people who are refusing, et cetera. People who have come to our clinics have gotten the vaccine.
Right, of course. Thank you. Interestingly, I was looking at your numbers and I looked at phase 2, and I've now got 2 different reports of when I, age 64, will be getting the vaccination. Yesterday, I looked on the Toronto Star and it looked like I'd be getting it in August. Your slides said May. Is there a regional priority that's established as opposed to a provincial priority? Is this best estimate, or is this hard and fast?
I would say the initial framework and prioritization of those 3 phases were fairly conservative initially. But as then we take that and operationalize it, and using the number of people we can get through to get vaccinated, we can shift that accordingly. So if we get our phase 1 clients vaccinated ahead of schedule, and vaccine dependent, of course, we can then shift to phase 2, which if you're saying you're in the phase 2 category, then you would theoretically get it sooner. So we work on, we're going to operationalize it to be as efficient as possible, to get other phases happening sooner, which will mean people of eligibility will get it sooner as well. So that's the approach we're taking.
Yeah, thanks. It was because I saw the 2 different numbers. I thought I'd better get that clarified, not just for me, but be any confusion. And thanks very much. Now, the reference to high risk being completed by the end of February, and this is an opinion question for you. Is this realistic or ambitious? Are we looking at that as our best shot, or do we think clearly we can have our high risk done by the end of February?
All indications that I've been informed of is that is the plan, that is the intent. I would say it's realistic and ambitious at the same time. Realistic, because if we get the vaccine, we can do it. It's ambitious because I don't know when we'll be getting that full allotment.
Right.
So it's tricky now to say what we will be doing in February if something goes awry with the just-in-time delivery piece. So it's a little bit of both, but the plan is to have our priority populations done by the end of February.
Yeah. Finally, one last question, if you wouldn't mind, is to just confirm, because there has been some discussion of mixing of vaccines, and I'm hearing you say very clearly that there is no suggestion that vaccine is that
correct. Right now, we're using Pfizer to vaccinate our long-term care, high-risk staff, caregivers, et cetera, that direct client care piece. And then the Moderna vaccine will be used to vaccinate our residents of those facilities. So there are two separate supply chains, two separate populations that are going to be vaccinated, and different plans to get them all done.
lovely? Okay, thank you very, very much.
And Councillor Gawler.
Thank you, Anthony, your worship. Thank you very much, Mr. Beveridge. I appreciate your presentation. I did cut out for a moment, so I apologize if you did mention this, but I wanted to ask, of the 80% of cases that you have been able to track, is there going to be information about where those cases are happening? Because we are all following the lockdown, and we're being careful not to expose ourselves, and yet we're seeing a large number of cases in the community. So is there any guidance that would be coming forward from public health about where we may be slipping because we think we're doing a good job, but we need to be more careful in certain situations?
Right now, indications suggest that its social gatherings continue, and that's the high risk activity with COVID transmission. It's a very transmissible disease, and if people are going to continue to socially get together, and even if it's at work and you're having a cup of coffee or your lunch in the lunchroom, you take your mask off because you have to take it off to eat. But people let their guard down when they're taking a break. And we're seeing transmission happening in those types of settings. We still see people getting together in their houses, and so the social pieces, and we're social animals. Humans are social, and so I understand the need to be socialized and socializing. But that's where this virus is really going to get us because of its transmissibility in social scenarios. So it's not necessarily being transmitted at work, but it could be transmitted during someone's break while at work, so to speak, or meeting a colleague for takeout, and there's somehow some sort of transmission. So we're still seeing that social transmission, as opposed to, and we still have all our outbreaks on the go from long-term care. We have outbreaks being tracked and monitored at institutions as well. But the highest rate of transmission is happening socially, and that is a concern, because that's the piece that's very difficult to control, because it's not really a controllable setting, so to speak.
Okay, well, thank you very much for that. And just as a follow-up, when people are gathering, is it that they're visiting friends in their backyards and they think that by hanging outside of the house in the backyard they're safe, or is it that people are actually breaking the rules of the lockdown and they're going into homes that are not their own?
I think you could say it's a little bit of both. It's indoor and outdoor, mostly probably the indoor, because that's where we're the least what's the word I'm looking for? Diligent, because we're letting our guard down, because we're comfortable. I think people outside are a bit more diligent, and but I still see groups of people out together outside. Are they all related? I don't know. It's hard to say. It's really hard to say on the exact location where someone is getting exposed based on indoor or outdoor environment.
Okay. Thank you very much for that. I appreciate that update. That's it, Worship.
All right, thank you, Councillor. Chris, and through to you, or maybe to our clerk, Stephen, would it be possible, if you have the slides from this presentation, would you mind, you do have them? Yeah. So our clerk does have them, and the clerk will just send them to council, and then that way we can post it. Of course, they're available for anybody who wanted to watch this as well. Chris, we just want to really thank you again, and if you could give our best to all of your staff and to Dr. Mercer as well, please, and thank them for everything that they're doing. And I think it was actually very timely to have this presentation about the vaccine rollout because it is so fresh. It's not even a week that it's arrived in Guelph, and also being the first public health unit in the province to be able to administer it. It's good to put a lot of the false narratives to rest and to put the facts out there for people to realize that you do have it under control, that you are ready, and that, of course, most of it is dependent upon the delivery. But that you are ready to move as quickly as you possibly can once these things start to roll out a little bit better. So, Chris, any final comments from you at all, or are you good with that?
Just one last thing, Your Worship, is that all we're working with right now is subject to change. It is vaccine dependent, and we are dependent upon the ministry for that guidance in that direction. And if that changes, I know there were conversations last night that as we work through that discussion, what we talked about today could be very different tomorrow.
Sure.
So we are in a very plastic state, so to speak. It is a state of change. And so we need to be able to respond and adapt to that change. But at the same time, the community has to understand that it is a fluid environment in which we're managing, and therefore things may change down the road. So it's just, nothing's for sure just yet. It is a constant state of change for us.
Absolutely, for sure. Definitely recognized. Sorry, go ahead.
And I was just thanking you for the opportunity to come to council today.
Yeah, no problem. And as I said, I think it's just good timing for this. So I really do appreciate it. Please give our best to everyone. And I hope it was very interesting to me. I hope it was to council and to the public as well. I think it really clears up a lot of information that needs to be public. Part of the columns there was transparency, as you stated, and this is just one of those ways we can do that. So thank you very much, and we'll let you go. Take care.
Thank you, Your Worship.